Okay, that's much better. This is what I'm used to. I don't know what was going on with the computer. It was all weird. There's better lighting this way anyway. Um, Hello, anybody who's on or hops on. I started a video earlier, but it was acting funny, so I decided to restart it. So, I had several people message me asking me if I had my pathology reports back. And it kind of occurred to me that I don't think I had mentioned about that in any of the other lives. So I wanted to kind of, I guess, recap about that and kind of what's been happening this week. So, but yes, I did get the pathology report back. Basically, they said that the surgeon said she got good clear margins on the tumors, the 2 actual tumors in my breast, and which is good. It's a positive thing. When she did the sentinel node biopsy, they found some micrometastases, which is that's what it says, microscopic metastases, which had me a little confused because when she initially was telling me that she wanted to do the sentinel node biopsy, it was because she kept saying that there was a node that kept showing up on my scans that was concerning her. And that would mean that if it showed up on the scan, it would show up round and like kind of bloated looking, I guess you could say, instead of what a normal lymph node would look like, which would be kind of like a deflated kidney bean almost. So that told me that it was probably round and inflated. That would make it alarming. It looks different. But when they did my scan the morning of my surgery, the radiologist couldn't find anything abnormal. And I shared about that because I was like, yay, that's good. Like what I've been doing was working, because in working with my naturopath, all the stuff that she was been doing was an attempt to prevent anything from going outside the breast area. And as she said, if anything had started to, we could try to pull it back in. So knowing that the radiologist said that he didn't see anything abnormal, it indicated to me that that could have been what was happening, that if there was something abnormal, we were able to pull it back in with the all the different treatments, techniques, whatever you want to call it, that we'd been using before then. So she does a sentinel node biopsy in the surgery, says that she found some micrometastases, which again, that wouldn't necessarily show up on the scan. So that kind of tells me that what we were doing was working, because it was pulling it back enough that it didn't look abnormal anymore, and all they found was some micrometastases. But because there was something in there, they still had to go forward and do the additional surgery of doing the axillary node dissection, where they took more lymph nodes from under the arm to test, to make sure that no other lymph nodes had anything. They came back clear, so all was good. It had not spread into the lymph nodes to that extent, other than the micrometastases. But all of that is out. And since then, I have had virtual appointments with a medical oncologist, as well as a the radiology guy, the girl, sorry. And I was really thankful, because going into this, I'm not gonna lie, I was really scared, because after being debilitated by those autoimmune diseases for a decade and being entrenched in the medical system, mainly rheumatology, neurology, cardiology, all those other things, I never felt like I had a doctor that supported me and wanted to help me in a way that was comfortable for me. they never entertained or supported me whenever I would suggest doing alternative types of things to help with the symptoms, or supplementing, or diet, or anything. They would always just kind of brush off and be like, well, you can try that, but it's probably not going to do much. You still need this prescription, and we're going to write you this other prescription for these symptoms. And it was all about allopathic medicine only. And so knowing where I've come since then, and how independent I have gotten in the ways that I deal with my health, I was very nervous going into the cancer community, knowing that the standard of care is to treat cancers with chemo and radiation. I understood that because they were larger tumors that I would have to kind of suck it up and just go through with the surgery. But I was very hesitant about chemo and radiation. One, because in all the research that I've done, many cancers that are in that mid-range, like mine is, the stage 2 areas, don't even respond to chemo. Of course, there's variable factors, but the general consensus is you shouldn't just jump right into chemo just because you have a cancer, even as like a stage 1. It's better to do, there's a test that you can do that's called an Oncotype test that tests the tumor directly to see if it would even respond to different types of chemo. So I had to specifically ask about that, but when I spoke to the medical oncologist, he was very open-minded. He was very nice, and he said, going into this, seeing everything that you've gone through and how because I don't know, maybe they've documented it in my record that I reversed the autoimmune diseases through nutrition and did it on my own. So maybe that kind of gave them an indication, the type of mindset that I had. I don't know. But he told me, honestly, I was very nervous even mentioning the C word to you. He said, because, you've been through so much, and I just want to support you and what you decide. And he said, I don't believe in going in like a bull in a china shop, which I was like, yes, thank God. And he agreed with me that, many times doing chemo can actually cause cancer later on. He knew that I was kind of on the same wavelength as far as like knowledge about the body and how this stuff develops and things, and I appreciated that. And so, I asked him about the Oncotype testing. He's like, yes. He's like, I'm glad you asked. He's like, I think that would be a good thing for you. He said, I will send the tissue samples out, and if it comes back, because he said that they come back in a score, like a range of low, intermediate, and high. And he said, if it comes back low, then we'll say, forget it. We'll do alternate things. If it goes back medium, he said, we always kind of are left with the, So he's kind of like, it's like a toss-up. He's like, if it comes back high, but you decide that you don't want to do it and you want to stick with your naturopath oncologist and the therapies that she has you doing, he's like, I will support you regardless. He's like, the main thing, he's like, I know that in my line of work, in oncology in general, he's like, especially younger women, we tend to overtreat. And he's like, you're right on that border. He said, technically, with women who are typically in between the ranges like 30, 35, maybe up to 40, they like to treat them more aggressively because, and the thing is he, after, I'll kind of get to what the end of it is, but he said that because what happens is we treat them, and maybe we might only do chemo or radiation, and then 5, 10, 15, even 20 years from now, they develop another cancer, or it's metastasized. Then we end up kicking ourselves saying, we should have done this. We should have treated it more. But then he also went on to agree that chemo and radiation, whether used in conjunction or separately, both have the risks of creating cancer later on. So that tells me that they're, by their own admission, that treating with chemo or radiation or both, it still increases your risk of developing a metastases or a different form of cancer later. So he understood my concern and my reservations in doing that, because my whole point is to build my immune system up. So whatever microscopic, teeny tiny, itty bitty cells that could be lingering in my body, my immune system will handle. Because as I know a lot of you have heard me talk before, that we all have cancer cells circulating in our body at any point in time. It's a matter of if those cancer cells are given a weak point and the perfect environment for them to proliferate. That's when cancer develops. Okay? If your immune system, if you're boosting your immune system up in different ways, and not just with nutrition. I want to make that clear, because I know everybody thinks that I'm all about nutrition. It's not just about nutrition. There's many different factors in your life that need to be in balance for this to kind of remain stable. But I don't want to put my body in that position where cancer cells can proliferate again. So that means I don't want to go through harsh treatments that are going to cause more damaged cells in my body. That's what cancer does, because it doesn't discriminate between healthy cells or damaged cells or cancer cells. It damages everything. Same thing with radiation. You know, I spoke to the radiation oncologist, and thankfully, thank God, she kind of had the same viewpoints. She's like, I'm not here to tell you what you have to do, what you need to do, what I think you should do. I'm here to give you the pros and the cons so that you can make an educated decision based on your situation. So in that, she said, and this is kind of funny, because when I've talked to a couple people about this, they're like, okay, that's kind of like a no-brainer. So in that, she said, the positives of having radiation, even though there's no more tumors, there's no more cancerous nodes, there's nothing. She said that in young women, they tend to want to still radiate the chest wall just to get those microscopic possibilities. But, and she agreed with me, that doing radiation is like taking a blowtorch to a spider. Now, I know that many of you out there are like, oh, yeah, let's do it. You know, because you don't like spiders. My husband's one of them. But you'll get rid of the spider, but you're also going to damage everything around it, okay? You're going to cause damage, no matter which way you look at it. The spider will be gone, but everything's going to be ruined. So, and she agreed that that's exactly what happens. She said that the benefit, one benefit of having radiation for me is that it could lower my chance of it coming back in the next 5 years by 10%. 10%. Then she said, okay, well, I'm going to let you know the risks based on my situation. Okay, everybody's cancer situation is different. Just because somebody has breast cancer does not mean that they're all going to be treated the same or even remotely the same. So she said that the risks are, one, they would have to radiate from my neck, so up here where these lymph nodes are, all the way down to the bottom of my rib cage, all this whole entire side of my chest wall. So she said, okay, starting from the top down, one, I already have cording where it's called cording, but it's basically like string or rope-like scar tissue under my arm where they did the axillary node dissection. It's apparently there's like a 20% chance that you can get it. I fell in that 20%. It's painful. It causes limited range of motion. There's a lot of pulling. I have to do extra PT. massaging, and actually it goes onto my arm, but it also goes over the top of the breast. So it can be very uncomfortable. That's also another reason why I'm using the red light therapy, like I posted about yesterday. But she said that it will make the cording worse. It will also cause hardening of the skin on this side, as well as capsular constrictor. I don't know if I'm saying that right, but basically it's going to ruin the implant, which that doesn't concern me because these aren't staying in. These are temporary, and I'm having the final reconstruction done in the fall, God willing, if the world is spinning again. But so that's the top side. Then she said that because they're radiating just my skin, because I had a skin sparing mastectomy, meaning they basically hollowed out my breasts like a deflated balloon, if you want to kind of visualize it. So all I have is the skin. There's no breast tissue left. Typically, when women will get radiation, they'll have like a lumpectomy, where they went in, they just surgically removed the lumps themselves, so they still have all that fatty breast tissue there. So she had said that basically, one of the side effects of radiation for breast cancer patients is a kind of sunburn type of rash from the radiation, obviously. But she said that for me, because all I have is the skin, there's really nowhere for the radiation to penetrate. There's no fatty tissue for it to penetrate into. So mine wouldn't be a mild sunburn. She said it would be a severe blistering burn, which, hello, who in the hell wants that? I mean, I just went through, trying to deal with blisters down both of my sides from the contact dermatitis. You really think I want to deal with painful sunburn blisters on my entire side? No, I don't. Okay, I'm hearing her out. She continues on and says that also, because she's like, based on your pictures, you're a slender woman, you don't have a lot of meat on your upper torso area. She said same thing kind of applies in the rib area. There's not a lot for it to penetrate into, so one, it increases my risk for osteoporosis in my ribs and getting broken ribs easily on that side. It also will cause scar tissue to build up in the lower part of my lungs. And I'm sorry, this is just kind of comical for me now, like listing all these things off. And she said that, starting back up, I went too far. So back here, up at the top part, your heart is on the left-hand side. And she said that, so in order to radiate the right area and not radiate my heart, I would have to lay on my side in a specific position, which would be painful in itself because of the cording, which, hopefully it would be resolved by then, but you never know. So I have to lay on my side in a specific position, and I basically have to take a deep breath and hold it for 30 seconds or more, from what she said. So as she's talking, I do it, and I'm holding my breath. I barely make it 15, 16 seconds. And she's like, and I was like, I don't know if I can do that. And she's like, yes, that is an issue, particularly with anyone who struggles from severe anxiety or PTSD. And I was like, and she's like, yes, that is one of my concerns for you with having PTSD, because having to do that, it creates an internal, an internal state of panic. And if you don't hold it, you risk them radiating your heart. So that was a risk factor. And then also, so the heart, the ribs, the lungs. And then the last one was that, and she's like, and finally, having radiation increases your risk of developing a cancer later on. Mainly, in my case, it would be a skin cancer or a lung cancer on that side. So I'm sitting here. She's like, I'm not trying to talk you out of it. I just kind of laughed because I'm like, well, you're not convincing me either. I just basically told her, I said, I'd like to talk with my naturopath and see if either any of the treatments that she already has me doing or the ones that she has planned for me in the future could serve this same purpose. In, all of this to take care of possible microscopic cancerous cells that could be lingering. So, which that is the goal of doing all the stuff that I'm doing, is to strengthen my immune system, the part of my immune system, because there's two different parts of your immune system. Okay, there's your oh my god, I just draw a huge blank. There's the innate immune system and the it's not coming to me. Anyway, there's two different parts of your immune system, and one of them handles like the everyday viruses, colds, flus, coronavirus, that kind of stuff. And then there's the other internal part that really kind of handles these types of things, the more chronic, severe illnesses. So the goal is to work on building that immune system up stronger so that it can handle any of the cancer cells that could be still lingering. So anyway, that's kind of where I'm at. I'm not convinced on either side to do either one. My naturopath oncologist is confident that we can handle everything with the various things we're doing. I'm still doing the vitamin C infusions. I'm starting mistletoe injections next week. I've been looking into doing ozone therapy infusions from another integrated medicine practice locally. But I don't know. I know for some of you out there, especially family, it's scary to you if I don't do what did they say. But I just want to kind of remind you of something. 5 years ago, I had been debilitated for so long and in such a bad state. My family's finances were in such a horrible state that I didn't want to live anymore. I prayed that I would go to sleep and not wake up because I was tired of being a burden on my family. I knew that if I didn't make changes, that those diseases would end up killing me. The treatments that I was getting were not working. I was only getting worse. And I felt completely helpless. It wasn't until I decided that enough was enough, and I was going to start doing my own research, get my own education on how to help my body get through it. I listened to my body, and that's how I navigated my way out of those 7 autoimmune diseases. That's why my lab work is completely different than it was 5 years ago. Looking back now, I've likely had this cancer since before I made that decision. Because they say that cancer, tumors, once you can feel them, they've been growing in your body for up to 6 years. My cancer was a slow-growing cancer, according to my pathology, which means it's been there for a while. Back then, my body was so unhealthy and so acidic. It was the perfect environment for cancer to start growing. And when I kind of look back on, these last 5 years, I had probably 3 years where I felt great. My world was, I was up here. I was on cloud 9. My world was great. I was happy. I was content. I was developing my health coaching business. Everything was going good. And then, bam. Trauma hits. my world crumbles. I end up in this hole, is what I like to call it. This deep, dark hole where other traumas from my past came flooding to the surface all at once. I felt like I was going crazy. I felt like I was screaming as loud as I possibly could, but nobody could hear me. The supplements I was taking, my body stopped responding to them because the frequency in my body, the chemical changes in my body had changed to the point that it was not responding to the supplements that I was taking. I started going backwards. I started feeling symptoms again. I started gaining weight again. I started getting pain and not sleeping well and having bowel issues and having complexion issues. And that is an indication to me that is when this cancer that maybe was already in my body, that started developed 5 years ago, maybe it was stalled for a while when I was feeling great and my body was in balance. And then when all this happened and my body went acidic again, that was kind of like opening the floodgates for the cancer to continue to proliferate and develop to the point that I could feel it. So what are my goals then? My goals are to prevent my body from being acidic again, to deal with the emotional traumas that caused me to be in that state, basically deal with my shit and process it, which a lot of people don't. You run away, and I did too for many years. Just ignore it and keep moving forward. To continue on my nutrition, because that's the one thing that so many of these doctors have said that I've got going for me. The one thing you've got going for you is you have your nutrition in check. Okay, what does that tell you? So, I guess what I'm trying to say here is I have confidence that I can overcome this without having to use toxic, dangerous methods that increase my chance of having cancer come back or developing a new cancer in the future because of the damage that those treatments cause, that are openly admitted by both my medical oncologist and my radiation oncologist. So I need those who care about me, who are scared that, if I don't do what they say, that it's all going to go awry. I need you guys to have confidence that I'm listening to my body and I'm figuring things out and I'm seeking out the right people to help guide me through this in a way that doesn't cause more stress or trauma on my body. So I hope that came across right. But anyway, so I know this was long, and thank you if you hung in there to listen to it all. Just wanted to give you an update on where everything is at. And yeah, that's about it. So hope you guys are having a good Wednesday and you're not going crazy yet, and you're enjoying your family. So I encourage anyone, since a lot of times people say that they don't have time to work on themselves, to focus on things, but I encourage you to take advantage of this time. And if you know that there's things that are in your diet that you aren't doing, or you're just ignoring and saying, whatever, I'm going to do it because I want to, I'm stressed, I'm allowed to, or even the mental and emotional stuff, I encourage you to kind of take some time for some self-reflection and think about those things, especially right now, the mental stuff, big time right now, because I tell you what, the biggest thing that I'm afraid of with all of this stuff that's going on is the repercussions of mental health that it's going to have on people. I've been there, and it's not a good place to be. So take care of yourself, love your bodies. It's the only one you've got. And you're the only one that can keep you healthy. Nobody else. I've said this many times. I have cancer, and I wouldn't ever tell somebody that they have to wear a mask or they have to get a vaccine or do something to protect me. That's my job. That's my job, is to protect me. Okay? And I do that by making sure that my nutrition is in check and I'm not doing things that can further weaken my body. And if I am concerned, I'll simply ask people just to keep their distance for a while. Or if I'm out in an area where is a higher risk, like when I go to the hospital to a doctor's appointment, that's when I wear my mask. But I don't know, just like I said, just take care of your body, love yourself, love your family, and we'll talk soon. Talk to you guys later. Bye.